Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to discuss what cholesterol is and how it can impact your health. Make sure to watch until the end because there is important information for people who want to have low blood cholesterol levels. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is cholesterol? What happens if my cholesterol levels are high? Cholesterol is a type of lipid, or fat, that is found in your blood and is essential for the proper functioning of your body. It plays a vital role in building cell membranes, producing hormones, and forming substances that aid in digestion. Cholesterol is carried through the bloodstream by lipoproteins, which are like tiny packages that transport cholesterol to where it's needed. Cholesterol is produced by your liver, but it's also found in some foods, particularly animal-based products like meat, eggs, and dairy. There are two main types of cholesterol: low-density lipoprotein, LDL, and high-density lipoprotein, HDL. LDL cholesterol, often referred to as bad cholesterol, LDL carries cholesterol from the liver to the cells. If there's too much LDL cholesterol in the blood, it can build up on the walls of your arteries, forming plaques that can narrow and block blood flow. HDL cholesterol, known as good cholesterol, HDL helps remove excess cholesterol from the blood and transport it back to the liver, where it's processed and eliminated from the body. What is high cholesterol? High cholesterol is a condition in which you have too many lipids, fats, in your blood. It is also called hyperlipidemia or hypercholesterolemia. Your body needs just the right amount of lipids to function. If you have too many lipids, your body cannot use them all. The excess lipids build up in your arteries. They combine with other substances in your blood and form plaque, fatty deposits. These deposits may not cause problems for years, but over time, the plaque in your arteries grows larger and larger without you noticing. For this reason, untreated high cholesterol is dangerous. These extra lipids in your blood contribute to the plaque getting bigger without you realizing it. The only way to detect high cholesterol is to have a blood test. A blood test called a lipid panel will show you how many lipids are circulating in your blood. What is considered high cholesterol depends on your age, gender, and history of heart disease. High blood cholesterol causes, lifestyle and genetic factors both play a role in high cholesterol. Lifestyle factors include smoking and tobacco consumption. Smoking lowers your good cholesterol, HDL, and raises your bad cholesterol, LDL. High stress level. Stress causes hormonal changes that cause your body to produce cholesterol. Drinking alcohol. Too much alcohol in the body can raise your total cholesterol levels. Not moving enough. Physical activity like aerobics helps improve your cholesterol levels. If you do an office job or sit a lot in your spare time, your body won't produce enough good cholesterol. Diet. Certain foods can raise or lower your cholesterol levels. How does high cholesterol affect my body? Over time, high cholesterol levels cause plaque to build up in your blood vessels. This buildup of plaque is called atherosclerosis. People with atherosclerosis have a higher risk of many different diseases. This is because your blood vessels do important work throughout your body. So when there's a problem in one of your blood vessels, there's a ripple effect. When you have high cholesterol, plaque forms inside your blood vessels. The longer you leave it untreated, the bigger the plaque. As plaque grows, your blood vessels narrow or become blocked. Like a partially clogged drain, your blood vessels can remain functional for long periods of time. But they won't work as expected. High cholesterol increases the risk of other conditions caused by blocked blood vessels. Coronary artery disease. Ischemic heart disease or CAD are other names for coronary artery disease. That's what most people mean when they use the term heart disease. CAD is the most common form of heart disease in the United States and the leading cause of death. CAD occurs when atherosclerosis affects your coronary arteries. These are the blood vessels that carry blood to your heart. When your heart doesn't get enough blood, it weakens and stops working properly. CAD can lead to a heart attack or heart failure. Coronary artery disease can impact young individuals, with 1 in 5 coronary heart disease-related deaths occurring in people under 65. Early cholesterol level checks are crucial because plaque can gradually accumulate in the coronary arteries without noticeable symptoms, often leading to chest pain or heart attack as the first warning signs. Carotid artery disease. When atherosclerosis affects your carotid arteries, it's called carotid artery disease. Your carotid arteries carry blood to the large front part of your brain. When plaque narrows these arteries, your brain can't get enough oxygen-rich blood. Carotid artery disease can lead to transient ischemic attack, mini-stroke, or stroke. Peripheral artery disease or PAD. When atherosclerosis affects the arteries in your legs or arms, it's called peripheral artery disease or PAD. The arteries in your legs and arms are peripheral because they're further away from your heart and the center of your body. PAD is most common in your legs, but can also occur in your arms. PAD is dangerous because it often causes no symptoms. High blood pressure. High cholesterol is associated with high blood pressure, often known as hypertension. Cholesterol and calcium plaque causes your arteries to harden and narrow. So your heart has to work harder to pump blood through them. As a result, your blood pressure becomes too high. High blood pressure and high cholesterol are the two main causes of heart disease. Medications can be very helpful, but lifestyle changes can help these medications work best. Lifestyle changes are important for managing both high cholesterol and high blood pressure. Some of the changes include: eat less saturated and trans fats. Fast food can contain large amounts of both. But even formal restaurant foods can be high in saturated fat depending on how they are cooked. Eat less fried and processed foods. These include prepackaged desserts and snacks. Eat less sodium, salt. Some foods contain hidden salt. It is important to read the label in the store. Some restaurants may share nutritional information for menu items. Stop smoking and using tobacco products. Smoking is a major risk factor for heart disease and blood vessel problems. What medical conditions affect my cholesterol levels? Medical problems and cholesterol have a two-way relationship. High cholesterol can cause medical problems like atherosclerosis. But certain medical conditions can also put you at higher risk for high cholesterol. Here are some conditions that can affect your cholesterol levels. Chronic kidney disease, CKD. People with chronic kidney disease or CKD have a higher risk of coronary heart disease. This is because CKD causes plaque to build up faster in their arteries. People with early-stage CKD are more likely to die from heart disease than from kidney disease. HIV. People with HIV are nearly twice as likely to have a heart attack or stroke than people without HIV. Researchers used to think that this higher risk came from HIV drugs or antiretroviral therapy. They believe these drugs increase a person's cholesterol levels. Thyroid disease. Having thyroid disease can affect your cholesterol levels. This is because thyroid hormone affects how your body processes lipids or fats. The impact depends on the type of thyroid disease you have. Hyperthyroidism. This condition causes your body to produce too much thyroid hormone. Medicines used to treat this condition can raise your cholesterol levels, total, LDL, and HDL. Hypothyroidism. This condition causes your body to produce too little thyroid hormones. It also leaves you with higher cholesterol. In this case, treating your thyroid disease will lower your cholesterol levels. But you may still need to take a statin to achieve your ideal cholesterol levels. Your provider will discuss what is best for your individual case. Lupus. People with lupus often have higher levels of bad cholesterol, LDL, VLDL, and triglycerides. They also had lower levels of good cholesterol, HDL. People with active lupus have a higher risk of cholesterol than people with well-controlled lupus. Lupus increases the risk of developing coronary heart disease. This is because lupus exposes your body to chronic inflammation. This inflammation causes plaque to build up faster in your arteries. Polycystic ovary syndrome or PCOS. People with polycystic ovary syndrome or PCOS have a higher risk of heart disease. This risk increases with age. PCOS increases the risk of many heart disease risk factors, including diabetes and high blood pressure. People with PCOS are more likely to have high levels of bad cholesterol, LDL, and low levels of good cholesterol, HDL. Diabetes mellitus. Diabetes mellitus, type 1 diabetes and type 2 diabetes, doubles the risk of coronary heart disease and peripheral artery disease. Diabetes is associated with lower levels of HDL and higher levels of triglycerides and LDL. Now, check out this video to discover some helpful tips that will assist you in achieving a healthy lifestyle. Subscribe to the channel to receive regular health tips and advice. That's all for today, and always remember to stay healthy. Thanks for watching, and we'll see you in the next video.